Hello, my name is Tom Stinchcombe. I work at Duke Cancer Institute in Durham, North Carolina. I'm a thoracic oncologist who specializes in clinical care as well as clinical trials for patients with thoracic malignancies. I think most of us are interested in exceptional responders, and I think the definition is sort of varied. But I think all of us have seen patients that come in, get a therapy, and are several standard deviations beyond the median in terms of their benefit. A very vivid one with me was this is a little bit older, but a patient with an ALK rearrangement was referred into me. At the time, we had crizotinib, which was an early trial, and this drug had a median progression-free survival or disease control right around 10 or 11 months in most of these studies. But this woman stayed on it for 8 years with no evidence of disease progression. And I think that just a tremendous benefit, and I've never been able to figure out why, and had a very good quality of life. I've had another patient who had a BRAF V600E who's been on the combination therapy for several years with almost a complete response. And I think that these are very rewarding, first and foremost, for providers and the clinical team, to see these responses. But intellectually, they're very challenging because, if we do the same therapy, why do people get such a tremendous benefit? And I think the other challenge is that we really haven't found a good way to capture this benefit. I think particularly with immunotherapy trials, we see these patients at the tail of the curve, or 3, 4, 5 years out, who are still disease controlled and no evidence of progression and leading a very good quality of life. Is statistically, how do we design our studies to capture the situation when a minority of patients are getting a tremendous benefit? And then also academically and from a biomarker development standpoint, why are those patients doing this? And how can we pre-select those patients to really do this? And I think those are some of the biostatistical challenges in the field, as well as I think some of the biology challenge in the field is how to really predict that benefit, the tail curve. And I think we've really done it's been a challenge for, I think, doctors. How do you explain this to patients? We're so fixated on the response rate and median progression-free survival, and you see this throughout my talk too. That's our metrics, but how do we communicate the variability and the tail of the curve to patients when you say these are just averages, but some people do a lot better than average? How do you communicate 15 to 25% of people will be here in 5 years? The average may or may not apply to you. And I think that it's really been a challenge for providers. And I think it's a place where we really need to improve our patient education to really how to describe this phenomenon.